So if they can't get rid of it, they will chip away at it slowly, one piece at a time. That's what some Republican lawmakers say is their plan to repeal or roll back President Obama's health care law, and that plan coming amid new calls for hearings about insurance premium increases that we reported on here about a week ago. Now, Republican Senator John Barrasso out of Wyoming is with me now. Senator, good morning to you.
Good morning, Bill. Thanks for having me.
You got it. Thanks for coming back. You're a doctor first, a senator second. So this hits near and dear to you, but this is a tall order. When you know the sitting president has a veto pen in his hand, how can you be effective at overturning anything if you're going to try and repeal the entire bill or just to take away parts of it? How is that possible?
Well, the American people are going to be a big part of that come November when they go to the voting booths and say, we are tired, Mr. President, of you ignoring us, not listening to the American people. The president is disconnected with the voices of America. You know that 61% of Americans in this most recent Rasmussen poll have said they oppose this health care bill. They want it repealed and replaced. And if we can't immediately repeal the whole thing, we're going to strangle it off piece by piece, and there are places to go with that.
I understand that's your strategy, but again, you've got that veto pen that you're up against.
The president is going to see overwhelming, I believe, opposition to so many of the things that he has put. So that's why we're going to go after it, and you could go after part of it on the funding. You know, they have the Internal Revenue Service needs $10 billion to go and implement a number of the mandates that individuals buy insurance, the mandates that businesses supply insurance to people. And if we don't fund the Internal Revenue Service to go and investigate American citizens, then that's going to be money that's going to be one way to go against the funding.
So
another way is
speaking,
the health.
You could pass a law that would hold up the payments or the financing that would prevent the new health care law from going into effect. That would be your strategy?
You will not pay for certain enforcement provisions. If you don't put the extra $10 billion that they need into Health and Human Services to write all of its rules and regulations, that is certainly going to grind it, slow it down. We need to strangle it off piece by piece if we're not able to, with the president's veto pen, as you say, repeal the whole thing immediately.
I see. So you would do that on the Senate side. You'd need approval on the House side, too, to get that through. Is that right?
Well, I can tell you after November, the House, the makeup of the House is going to support that sort of activity to defund so many of the implementation parts of this, because this is a bill, this law, it's bad for patients and they know it. It's bad for providers, the nurses and the doctors that take care of patients, and they know it. I was visiting with them this past weekend in Wyoming. And it's bad for the taxpayers who are going to have to foot the bill, and they know it. And that's why 61% of Americans want to repeal and replace this terrible health care law.
Almost on cue, this is what you're referring to, the Rasmussen poll that we've referred to earlier. 61% say favor repealing it. You've mentioned a couple things in here. Just help me drill down just a little bit more to understand this, Senator. You could also target the mandate that requires Americans to carry health insurance or face a penalty. That's what the whole lawsuit is about in Florida that's ongoing, that involves 20 different states. Of everything you've outlined right now, do you think one has a better shot than the other?
Well, I'm delighted that these 20 different states have brought this, and that case is moving forward, and I'm hoping that the Supreme Court sees it the way that so many Americans see it, is that the government does not have the right to tell individual American citizens that they have to buy a product. So that's number one. We want to repeal the mandate that businesses have to supply insurance. I want to repeal what's called the Class Act, which even the Democrats call as a Ponzi scheme. Just this last week, we had a bill to take away part of the health care law that is really unnecessary, burdensome paperwork on small businesses. It's going to cost them billions of dollars. We had 7 Democrat senators vote with us on that. So there are things that we can do, Bill, to strangle this health care law, which is terrible.
Maybe I can ask it a different way then. Is there a consensus within the Republican Party, strictly on the Senate side, as to what to target? I mean, you've thrown out at least 3 different ideas. Is there a consensus over which one you want to go after?
Well, there's all of those, plus allowing states to opt out. So there are a number of ideas and proposals that we're advancing. We believe that after November and the elections, the American people are going to send a clear message, not just to the Republicans who have been listening to them, but to the Democrats who've been ignoring them, so that it's really 2 elections that are going to happen, because we need to make sure that that the president is a one-term president. And that's how we get somebody in there to deal with that whole veto issue that you raised, Bill.
Pending the outcome in 42 days or so, we might be very well reliving the days of health care reform yet again, as we did for the past year. Senator, thank you for your time. I know you're on the floor of the Senate. Once a week you give a speech on this. It's something we'll revisit with you and also your Democratic colleagues. Thank you, Senator.